Tonight, Chairman Brett Guthrie of the U.S. House of Representatives Committee on Energy and Commerce released new language for the budget reconciliation process that's beginning tomorrow. We are obviously still reading through the proposal, but we know enough, which is that it has confirmed our worst fears, that Republicans in Washington are going to try to pay for the Trump, Elon Musk tax cuts for the wealthiest people in this country by taking an axe to the Medicaid program and the SNAP program. That 1/3 of the children in Connecticut, 2/3 of people with disabilities, and 2/3 of seniors in long-term care settings rely on for their health care. You know, there's good, bad, and ugly of this bill. The good is very easy to talk about because there's not very much of it. There are a couple of provisions in the bill that actually very much mirror some of the PBM reforms that Connecticut is now considering in SB 11 and the bipartisan prescription drug task force. But on to the bad and the ugly. This bill has a number of provisions that seem designed to hurt people in Connecticut, that seem designed to take coverage away from folks, to put our hospitals into financial difficulty and our other providers, to take health care away from people and make things just more difficult for people in Connecticut. It freezes hospital tax payments, which will be devastating to almost every hospital in Connecticut, particularly to our safety net hospitals and our rural hospitals. It bans funding for Planned Parenthood. It attacks funding for LGBTQ children. And it attempts to restrict Connecticut's ability to use our own money, not the federal dollars, but our own money to pay for health care for immigrant kids. A commandeering of our state budget that just seems blatantly unconstitutional. For people who are on the Medicaid program, it makes health care more expensive because it forces states to add co-pays and deductibles to our working poor, forcing them to pay money out of their own pocket for the health care that they now get. Most of all, it blankets everyone in Medicaid with a huge amount of paperwork designed to force millions of families and children's and healthcare providers off the program, with constant audits, eligibility redeterminations, and what they call work requirements, but what we know is a job loss penalty. The folks at who brought you the Department of Governmental Efficiency want to say that they are for efficiency. But for hundreds of thousands of people in Connecticut, they are going to find more paperwork than they have ever seen before because the paperwork onslaught is how they think they're going to save some money to pay for tax cuts for billionaires. We don't know the full impact. We're still measuring it. But just one provision alone, which is to eliminate a new efficiency process, the eligibility and enrollment rule in this bill, that will cut 2.3 million Americans off of the Medicaid program, that one alone. We know that the other provisions will cut millions more, and all of this is unnecessary. And so my hope is that the members of Congress who are considering this will decide not to take on the people of Connecticut, will decide to stand with the Medicaid program and not bring unnecessary hardship to SNAP recipients, to Medicaid recipients in our state. And with that, I'll turn it over